Good evening, Barbadians. I first of all want to apologize for the lack of audio a few minutes ago. I trust that you all had an enjoyable New Year's Day and time for you to relax, some of you, and to reflect on the past year and indeed the challenges being confronted with COVID. When I addressed you earlier yesterday afternoon, I said that I indicated that I would have to report to you during the course of the weekend as it relates to the ongoing situation with COVID at that point in time. This evening, I'm here with the Minister of Health and Wellness, Lieutenant Colonel Bostic, the Minister of Home Affairs, Mr. Wilfred Abrams, the Prime Minister, the Honorable Mayor Amor Motley, and the Chief Medical Officer, Dr. Kenneth George, to report on a situation, an escalating serious situation as it relates to COVID and its incidence and occurrence in Barbados. Yesterday, we spoke of two cases which were of particular interest to us because they were among members of the prison staff, and they had participated in a bus crawl on Boxing Day. Today, I can unfortunately and regrettably report to you that coming out of the extensive testing being done overnight, that it has revealed a substantial increase in the numbers of cases, and perhaps over 80% occurring among prison wardens and indeed members of the Barbados Defence Force, who also participated in this bus crawl. As a result, first of all, I must commend the hard-working staff of the Ministry of Health and Wellness, many of them who worked all during the night, and certainly in terms of the lab testing and in terms of taking swabs for the various persons. We were able, I believe, up to now to have carried out tests on over 200 members of the staff of the Barbados Prison Service. I believe they expect to complete the entire amount, that is over 300, before midnight tonight. And indeed, they started testing members of the prison population last night, and is expected to be completed by tomorrow morning. So first of all, I have to commend those hardworking members of staff for the work they've done. And indeed, in starting the contact tracing, and I know that they have reached out to a number of persons, and they've been working assiduously in terms of contact tracing. Obviously, the Minister of Health and Wellness is here, and he will give you more detail in terms of the numbers of persons infected and the number of positive cases, etc. And he will speak to you also in detail in terms of the expansion, in terms of those persons who are involved in contact tracing. In addition, the Minister of Home Affairs will speak, because I know a number of you will be concerned in terms of the state of affairs at the prison, recognizing that if you have large numbers of prison workers who are positive, they will have to be isolated, and there will be, of course, concerns in terms of the prison, in terms of security, in terms from a health perspective, in terms of persons at the prison. And so he will be here to speak to you. In addition, the CMO will also speak on certain specific areas, and the Prime Minister will speak in terms of the overall process, in terms of additional measures that might have to be taken in circumstances which are indeed challenging, which are serious, but are certainly not outside of our control, and certainly to encourage you that there is no need to panic, but Barbadians need to remain calm and sensible in their actions and adhere to certain protocols. So with this, I want to invite the Minister of Health and Wellness, the Lieutenant Colonel Jeffrey Bostic, to address you.
Good evening, Barbadians and visitors to Barbados. A happy and prosperous 2021 to each and every one of you. Yesterday, I would have expressed my concern about the 5 positive cases which were under investigation. Of those 5, you would recall that 2 were officers of Her Majesty's Prison Guards. Aggressive contact tracing and testing commenced yesterday evening and continue as we speak in our efforts to wrestle with what is a most challenging situation. These efforts so far have resulted in some 100 cases under active investigation. And up to the time that I left the Emergency Operations Center to come here to Illawarra Court, there were 45 confirmed positive cases. 45 confirmed positive cases. These cases comprise 32 persons from Her Majesty's Prison Dodds and 4 from the Barbados Defence Force. The 4 from the Barbados Defence Force, along with 17 from the prison service, all attended a bus crawl on Boxing Day, the 26th of December. This bus crawl is now considered as a super spreader event. The Ministry of Health and Wellness intent is to test or swab all prison officers tonight and the remainder of the prison population by tomorrow. I cannot tell you that this is not a daunting task, because it is. I cannot tell you that we will have this matter dealt with by tomorrow or the next day, because we won't. What I can tell you is that the words that I said to you in my rallying call several months ago, that we will not retreat or we will not surrender to this virus, those words are far more important tonight as I speak than when I first issued them several months ago. This is a massive undertaking, no doubt, and perhaps the most challenging assignment of my life, including the 26 years that I spent as a military officer in the Barbados Defence Force. But I want to give the assurance that I have every confidence in the staff at the Ministry of Health and Wellness, because they're dedicated, they're knowledgeable, and they have shown beyond a shadow of a doubt that we have what it takes to wrestle with this monster, and we intend to wrestle it to the ground. We are going to work assiduously, day, night, whatever it takes to bring this matter under control. And as Minister of Health and Wellness, even though we may be walking through the valley at the moment, we will be at the mountaintop at the end of this journey. And I ask each and every one of you to join us, cooperate, collaborate. And I want to thank those persons who have volunteered to assist the ministry, those persons who are on vacation, those who have retired, those who are public health officials, that we as a country can confront this situation and defeat COVID-19 in 2021. I thank you. And I ask you now to listen to the Chief Medical Officer, Dr. Kenneth George, who will give you a little more information in relation to what I've spoken.
Good afternoon and good evening all. This is a fast-moving situation. The Health Emergency Operations Center is fully engaged. We are running near a 24-hour operation. And I will speak on 2 issues. One, the first one is the contact tracing. Only through contact tracing will we be able to overcome this threat. We have scaled up our contact tracing by identifying several teams that will be under the guidance of the medical officers of health. We have also identified a coordinator for the contact tracing. I would like the public to know that over 100 persons will be involved, including medical staff, environmental health officers, nursing staff, and even medical records clerks. As I have indicated before, contact tracing is the systematic way of finding every single individual associated with a case. This will require the cooperation of the Barbadian public. when we call on you and if you call on you. And you also need to volunteer information to us for action. So we ask the public to cooperate in this effort. The other issue I would like to address is our status in terms of what is available at the isolation center in Harrison's Point, St. Lucie. Currently, there are 48 persons in total in isolation, and most of those individuals, 12 of those individuals, are in primary, but the majority, 32, are in tertiary. When you're in tertiary, that means you are mainly asymptomatic or have no symptoms. So therefore, still for Barbados, over 80% of the cases we have been seeing are asymptomatic. We will continue to update the public on the contact tracing and all efforts to quell the explosion that has occurred at our prisons. Thank you very much.
Good night, Barbados. And for what it's worth, I just want to wish everyone a Happy New Year. We are dealing with the situation at the prison, and I just want to advise that in relation to recent questions from members of the press and the public regarding the presence of BDF officers and police at Her Majesty's Prison, Dodds, I want to confirm that this is part of the government's protocol in managing the situation at the prison. Following the confirmation of some officers testing positive for COVID-19, we have commenced the testing of all officers and inmates who were present at the facility. As a means of due diligence during this testing process, some staff and officers have been quarantined, which has led to the need for the reorganization of shifts at the prison and pending results. The deployment of Barbados Defence Force personnel and police officers is to supplement the shifts and security arrangements until normal service resumes. To date, there have been no reports of incidents at the prison, and the security of the prison is under control. I wish to repeat, there have been no reports of incidents at the prison, and the security at the prison is under control. The integrity of the prison and the safety of its population are a paramount concern to the government of Barbados, and all applicable resources will be used in this pursuit. It is a very delicate and challenging situation that we're faced with, and my best wishes and my heart goes out to those prison officers who have been exposed or who would have tested positive, and my concern is for them, for their families, for the inmates at the prisons, for everybody who can be affected by this situation. That is why it is critical for all persons who have had contact with the officers to step forward and be tested. This is not a time to hide. Where we go from here depends on exactly how fast we're able to bring this situation under control. To this end, while we have managed to test almost all of the prison officers who are associated with this incident or who would have been at the prison in the critical time, and we are expected to finish testing all of the prisoners, all of the inmates at Her Majesty's Prison, Dodds, by about 2 a.m. So by 2 a.m. in the morning, we should have tested everyone concerned. We wish to track down 3 officers that we've had some difficulty in contacting. And these officers are Mr. Dave Best, Mr. Paul Outram, and Mr. Nigel Hall. I am asking those officers please to contact the Superintendent of Prisons, Colonel John Nurse, immediately. Immediately. Anyone who knows the whereabouts of these officers, I will ask you please to advise them, who they may not have become aware that their presence is being requested. Please advise them to contact Colonel Nurse as a matter of urgency. But I just wish to end by saying the situation at the prison with respect to security is under control, and we're doing everything possible to minimize exposure to the public caused by this incident. And I wish the prison officers and all their families and their friends the very best in this most difficult time. But we have your back and we're doing our best for you. Thank you.
Thank you, Minister Abrams. And now it is my pleasure to invite the Prime Minister, the Honorable Mayor Motley, to speak to you in terms of certain specifics that are necessary now. Thank you.
Good night, Barbadians. It is with a sense of profound seriousness that I address you tonight, recognizing that we have been able to identify a super spreader event that regrettably was undertaken by Barbadians on Boxing Day. This event has precipitated a series of actions, and even as we speak to you, a lot of the work is going on. But I promised you from the very beginning of this government's term in office that I will always, always come to speak to you and to be frank with you. We could have left this until tomorrow morning and run the risk of persons speaking idly. Rumor abounds where facts do not exist. That is not the approach of my government. I'm here tonight because over the course of my parliamentary and public life, I've had to confront difficult situations before. Tonight is such a similar difficult situation. But it is one that I'm confident that we have the capacity to deal with. I am happy with the progress that has taken place in the last 24 hours. The reality is that there are countries that may have chosen to just deal with those who came up and to allow the rest to turn up. That is not the Barbadian way. Our way is to find out exactly where we stand and how we are going to propose to deal with it. As a result of that, after leaving you yesterday, we ensured that the process of testing every single prison officer who has worked since the 23rd of December is underway. The majority of them, as you heard from Minister Abrams, have been tested. There are still a few others, as I speak to you here from Ilara Court, who are being tested. And there are prisoners who will continue, having some been tested today, that will continue to be tested tomorrow. Why? Because every life is sacred, and we want to be able to intervene in a way that gives everyone the best chance of success in what this global pandemic has foisted upon us. It would be foolhardy for us to believe that we can do this without acting together. And from the very beginning of last year, January 2020, yes, it is now 2021, we took decisions to put ourselves in a state of readiness to deal with a situation such as this. We have always said we hope and pray that it would not happen. But the reality is that we live in a world where this thing has literally been endemic and has touched, and in fact, been of a far more graver nature in countries surrounding us. As it relates to Barbados, even as we speak, and in the few minutes since the Minister of Health has spoken, I've received information of more batches coming in with more positives from prison officers. They are not in a position to give me an exact number, and I'm not going to lie to you or mislead you or this country. But suffice it to say that I have given the subcommittee chairman, Minister Walcott, and Minister Bostic and Minister Abrams full authority to continue to speak to this country over the next few days. It is going to mean some significant changes. And why? Yesterday when I spoke to you, I indicated that we were putting in a curfew from midnight to 5 o'clock in the morning. Regrettably, since then, I could receive on my phone today a flyer for a lockdown line on the 4th of January. My friends, this is not a joke. And I told you yesterday that I know how to apply the gas, but I equally know how to apply the brakes. We as a nation met in March to determine what actions we would take to restrict movement and to restrict activities in the country. We met as a social partnership then. We took decisions together. We met again at the gymnasium a few months later, when we realized that the balance between lives and livelihoods was in fact leading to a significant increase in suffering among Barbadian workers and Barbadian families, and that therefore we needed to have more economic activity to ensure that people could get a salary or a wage when the week comes so that they can feed their families. There was general agreement that we would have to learn to live with COVID, but our responsibility was always to contain its spread. It is still our responsibility. Regrettably, what has happened with the bus crawl is the most perfect of unfortunate opportunities to literally happen. That you have persons in a limited bus moving together from place to place to place. This has necessitated the most aggressive form of contact tracing. And over the course of the last few hours, I'm satisfied that the Ministry of Health, we've requested back someone who's been seconded to PAHO locally, a Barbadian. We have also amplified the talented and experienced team at the Ministry of Health with respect to contact tracing, and we're also utilizing former BDF persons to assist with the supervision of that. We are satisfied that the families of those who have tested positive need now also to be quarantined in order to facilitate testing by them. What does this all mean? That over the course of certainly the next week and possibly longer, we are going to have a dampener and a further dampener of activities and actions in this country. As it relates to the issue of the prison and our national security, I'm satisfied that we have arrangements in place. 16 years ago, the Cabinet had to meet on a Sunday night to pass and to approve a bill that we will now pray in aid, the Prison Amendment Bill. That bill gives the powers to members of the Barbados Defence Force, as exercised by Her Excellency the Governor-General, to be able to operate within the prison, and similarly members of the Royal Barbados Police Force. We are satisfied that with the technology that we have at the prison is sufficient for us to keep that place safe. I will not go into the details of our national security with you, but I give you the assurance that even this event is not as significant as when the prison burnt, when we had to deal with far more graver issues because we were dealing with persons who could not be contained and not simply a virus that is threatening not to be contained. We also, at the time, took decisions to be able to ensure that at all stages, persons who live outside in the rest of the country can be safe. And what did we do? Last night, we took in over 150 prison officers, and we placed them in a quarantine facility where they shall remain, even those who tested negative, because there will be a second test for them in 5 days after the first test, as recommended by the Chief Medical Officer. It means that those who are negative will continue to assist with the management of the force. And while the numbers who have tested positive are significant, they are not the majority of prison officers thus far. And to that, therefore, we are grateful. With the amplification through the Royal Barbados Police Force and the Barbados Defence Force, I am therefore satisfied that the national security issues are under control. As it relates now to the wider issue of public health, we have to be more serious. I don't know where we have gotten drunk with this notion that the only way we can enjoy ourselves is with music and alcohol. And I have come now to recognize that I have to speak frankly all the time. And I'm not using a big set of long words or long talk to tell Barbadians, cut it out. Cut it out. When I ask persons to wear masks, I've not made it mandatory only because there are some people for whom the wearing of a mask causes serious problems. But I'm prepared to consider it if the public health officials require it. The difficulty is that a person who genuinely has a medical issue may well be that person who is confronted and fined. And it is not this government's intention to criminalize people unnecessarily. But if I don't see a significant uptick in the wearing of masks, and I'm not talking about wearing the mask like this, because that's not wearing a mask. I'm not talking about wearing the mask like this, because that's not wearing a mask. I'm not talking about wearing it like this, because that's not wearing a mask. And I'm certainly not talking about wearing it like this, okay? And I understand, because I'm one of the ones who sometimes I have to go and walk away from the crowd and take off the mask in order to breathe properly, because sometimes your chest gets tight, especially if you're doing a lot of talking. But there has to be a greater effort to remember the basic protocols of hand sanitizing, whether washing your hands or using the sanitizers. We've spent too much money putting sanitizers all over the place to encourage Barbadians in this respect. We've also indicated masks are available to persons who want it. But as I move around the country, it hurts me to see as many people who still are not utilizing it. A time may come when we will have to discuss the recklessness of members of the security forces having a bus crawl on Boxing Day in the middle of a pandemic. But that is not the time for now. Our time in the next 48 to 72 hours is to ensure that we literally contain the spread by ensuring that we bring in all of the persons with whom these persons had contact, and to literally quarantine, restrict them, test them, and where necessary, take the appropriate action to treat them. The good news, if there is any, is that there is the majority of them, I should say, the majority of them by far, I'm told, are asymptomatic. In simple words, they have no symptoms. But that is in fact the core of our problem. Because people feel well, they're walking around believing they are well. And that is why over and over I've said to you, including yesterday, assume that everybody around you has COVID and assume that you have it too. And if you assume that you have it and you don't want to give it to somebody else, then you are taking the action. And we have an old saying in Barbados, one blows kill old cow. If each of us does what we are supposed to do, then cumulatively we will be able to succeed in this matter. I want to suggest to you, therefore, that this is not a need for us to panic, as I said. I've known far worse situations, and when the prison burnt, believe you me, that was a much, much graver situation. Having said that, this is a serious situation, and it is a challenging situation, and it requires cooperation. But I've been in public life for 30 years, and I know that with discipline and with the capacity to follow a very clear mission to which all of us subscribe, we can deal with this. What does this mean? That certainly for the next 7 days, but possibly 14, that there will have to be greater discipline on the part of Barbadians. I have therefore advised the Attorney General to draft a further directive that will allow us to institute a curfew from 9 o'clock at night from tomorrow, the 2nd of January, for the next the next 7 nights until the 9th of January, but with the proviso that we may extend it until the 14th or further if necessary. That dampener is to still allow persons to be able to go about their business and to do their work, but at the same time to ensure that we reduce significantly the numbers of persons moving about. We did that yesterday when we announced also that Monday and Tuesday would be closed to businesses other than supermarkets and gas stations, who obviously need to facilitate people's access to food or medicine or other urgent things as they do on a bank holiday. With those measures in place, we also believe that with immediate effect that we were allowing official gatherings of persons up to 50 or more. But now that we've seen the increased numbers of positives, I have equally advised the Attorney General that there are to be no banquets, social gatherings, fetes, limes of any number whatsoever. I want to speak to those who operate bars, restaurants, shops, and who go to the beach. We are not yet at that stage, but I know how to press the brakes further, believe you me. And if in the next 72 to 96 hours I do not see an improvement in people's behavior, then I will similarly be taking action there. With respect to persons coming to Barbados, the Chief Medical Officer and the Ministry of Health will always recommend if they feel that there is need for further action. At this stage, they have advised that is not the case. We have a number of persons on island who are here for limited periods of time. They have to be able to get back out. But if necessary, believe you me, I am in a position to take action with respect to that too. But this government does not act arbitrarily, and we act on the basis of sound advice, first given and primarily given by the Ministry of Health and the CMO, but supplemented by our consultations with the Pan American Health Organization and its leader, Dr. Etienne, as well as the World Health Organization and its leader, Director General Dr. Tedros. These persons have been exceptionally gracious in cooperating with the government of Barbados, as well as with the chair of the the Gavi facility that is dealing with the COVAX vaccine. I'm in daily contact with a number of persons, and I have every confidence that we are seeing light at the end of the tunnel. I said to you yesterday, we expect that vaccines will be available, hopefully, within the next 3 months or so under the COVAX facility, but we are equally seeking to purchase separately on a parallel track. Life does not give us what we want. All of us know that. There's not a human being that any of us know that does not know what it is to face challenges. But how we face the challenges and what we do determines our success and determines our resilience. We come from a resilient people, and our people have faced far graver circumstances than what we face now. Do we want to face this? Absolutely not. But are we capable of getting over it? Yes, we can. The good news is that the CMO has advised to, as they have done previously, that persons who are asymptomatic will generally be able to be released within 10 days or so, and based on continued testing. So that what we are asking people to do is not to run a marathon with respect to this additional restricted activity. But if we can do the right thing, and if we can just cut out the bus crawls, cut out the linemen for now, it ain't gonna kill you. It ain't gonna kill none of us. But our failure to observe the protocols. And with restaurants, for the most part, as I said yesterday, all reports coming is that they at least have been recognizing the protocol. They employ Barbadians and they ensure that Barbadians can work, and therefore, while we are going to 9 o'clock, we recognize that they are in a position, especially for persons who are visiting, to be able to serve them from as early as 5:36 until 8 o'clock, 8:30, and then you make arrangements to get home your staff. This is only for the next 7 days. I'm also asking persons who have been told by the PSA to contact the Ministry of Health or to go to the Eunice Gibson Polyclinic. I am not happy with the fact that they have been asked to just come on their own. If persons cannot drive themselves and therefore put no one else at risk besides their family who lives in the same house, would you kindly call the numbers that Minister Walcott will give you at the end so that the government can send for you to bring you to the Eunice Gibson Polyclinic so that you are not mixing on public transport to bring persons there. So against that background, I am truly asking this. There also is a social media campaign of panic. It has to stop. The only people who can talk to this country are the persons who are authorized under the Ministry of Health, the Chief Medical Officer, the Minister of Health, the Cabinet Subcommittee that I've spoken about, and the official forms of communication. I fully anticipate that the ministers will also be available to the press for questions as soon as we have more data. But if you know anything about managing a challenging situation, you know that your first responsibility is to contain it, stabilize it, and then deal with the consequences or the persons who caused it thereafter. At this stage, we are in containment mode, and at this stage, we are in communication mode. Why? Because it is important that whatever I know other than the details of national security, that you must know. I promised you that from the time I took the oath of office at Government House on the 25th of May. I have no cause to veer from it. I also promised you that anytime we received a single case that we could not tell you how the person got it, we would also come to you and let you know specifically our concerns. The first time that has happened is yesterday. I'm not going to be distracted by those who now want to have idle conversations or play the blame game. Look at me. There are no eyes in the back of my head. My eyes in the front. And my responsibility is to the people of Barbados, as is my government's. Those who have opinions, they are free to share them. But at this point in time, our responsibility is to contain and move forward. Mercifully, because of the nature of the virus, it means that if we manage this well in the next few days, that within less than 2 weeks, we can try to contain this as far as possible. But we do need the cooperation. Minister Abrams spoke about 3 prison officers who we've asked to contact us, and why? They've been trying to get them all day, and this is not a joke anymore. And I'm asking for those 3 prison officers to present themselves immediately and in the interests of this country and themselves and their own well-being. Similarly, I'm asking for those who were on that bus crawl, to those of you, as we said, who cannot drive yourselves and your members of the household, call us and we will send for you. But do not use the public transport mechanisms at this stage. My friends, every day is not sunny. In fact, today is the 1st of January, and I woke up and looked at the ocean. The ocean had an anger in it that we've not seen for a little while. And the truth is that the ocean tomorrow can equally be calm, or a few days from now. That is life. And that is regrettably the circumstances in which we find ourselves. Those of us who lived or had grandparents who lived, or parents who lived between 1910 and 1950 did not know a world of stability, because they were thrust from World War I to the Spanish flu, to the Great Depression, to the riots and revolution of the Caribbean, to the rise of fascism, to World War II, all in their life before they saw normalcy. Our generation has been blessed, because for the most part we have known stability and we've known normalcy. But normalcy and stability carried with it a price of exhaustible, of preying on the resources of the earth and ourselves in a way that is not sustainable. And to that extent, we find ourselves fighting all kinds of viruses over the course of the last few years. I have accepted a very serious responsibility, as I told you, with the World Health Organization for a One Global Health Initiative to be able to deal with the spread of superviruses. So we know that this is real. I ask Barbadians, we have one of the best systems of public health in the region. We have amplified it. We have received the support of the majority of Barbadians. But the handful of persons who continue to believe, and this is not just visitors now as some would have us believe, this super spread event regrettably was caused by our own. We know better, and we need to do better. I ask us not to be involved in recriminations at this stage, but to be involved in the effort of helping us to contain this virus. If anyone has information that they feel that they need to share with us, please feel free to do so with the information and contact information that Minister Walker will give you. Earlier I said that I've asked them to continue to brief the public on a daily basis, just as I did as Attorney General when I was involved and in charge of the dealing with the burning of the prison, because we know that where there is an absence of communication, rumor and fake news dominate. We are not going to allow that to happen, and that is why I spoke just now about the negative panic comments and stoking of things on social media. This country, Trinidad, Jamaica, they had similar events in their prison. They have moved on. We too shall move on. That this has happened is absolutely regrettable. That we can overcome it is absolutely possible. That we need your support in so doing is absolutely necessary. And that I humbly ask you as your leader to do so is now what I am forced to do, and do so willingly. And I know from my interaction with most of you that 99% of Barbadians will cooperate as we go forward now. But I ask us, please, in this next 7 days, adhere to the curfew, adhere to the protocols, and not for the next 7 days, or not even when the vaccines come. The wearing of masks and the sanitizing must become as much a part of your life as eating, drinking water, taking a bath, all of the things that we do every day. And if we can do that, then we will be able to get through this global pandemic with minimal dislocation and minimal loss of life. We have lost 7 persons so far. We want not to have any additions to that. And I end on this point. Every time that I've spoken on this issue, whether in public or in Parliament, I've always said that we are grateful for what has happened thus far. but what in catch you in pass you. And why have I said that? Every morning of life, I pick up the phone and I wait for communication from the Minister of Health. And I know, as I keep saying, we are as strong as our daily vigilance. We are as strong as our daily vigilance. I ask us, please, to come together as a nation. This is a challenging period for the nation's life, but in the scheme of things, given our history, from slavery to colonialism to riots and revolution to prison burning, this is something that we can overcome with cooperation and with discipline. This is the 1st of January. I would have much rather be speaking to you about other things, but there is time enough for that. Let us deal with this business first, and we will continue to talk. This is our country. We are one family, and whether it is good or bad, we shall rise together, ensuring that those who are most vulnerable among us shall be lifted up by the rest of us. And those who fail to take heed, we all know hard ears you won't hear, own way you can feel. Good night and God bless.
Thank you, Prime Minister. And we've heard from the Prime Minister, you've heard from Minister of Health and Wellness, and we've heard from the Minister of Home Affairs. It is indeed a challenging situation, a serious situation, but they've all admonished you not to panic, to remain calm, do those things that you know that you should do in terms of wearing your mask, sanitizing your hands, and physical distance. You've heard in terms of the good work being done by the Ministry of Health and Wellness, the hardworking staff, in terms of the matter of testing, taking the swabs, contact tracing, and indeed in terms of the work being done at Harrison's Point and the other quarantine facilities. You've heard in terms of the preparations being made in terms of the security of the prisons, and also, I should say, I don't know if it's been said earlier, in terms of we mentioned that there was a few cases at the BDF, and indeed the persons who attended the cruise at the BDF have been quarantined on that facility, and they're doing their own contact tracing and testing. You've been told that in terms of anyone who participated in that bus crawl and have not yet reached out to the ministry or have been assessed, that you can call 536-4500. 536-4500. And indeed, if you can make your own way to that polyclinic, Eunice Gibson Polyclinic, to do so certainly between 9 and 4 a.m. tomorrow. So that we need to get all of those persons who participated in that bus crawl to make their way, if they can do so, to the Eunice Gibson Polyclinic tomorrow, or indeed to call 536-4500, not to use the public transport. And I nothing much less to say today. Until tomorrow evening, as I promised you yesterday that I would come back to you on Saturday. We regret that we have to bring this sort of news at this time, but we thought it was very vitally important that all Barbadians are aware of the seriousness and what has happened in terms of the escalation, and we needed to make you know what is happening. May I say, continue in your mode. God bless, and do have a pleasant evening and the remainder of New Year's Day. I thank you.